Okay, so today we're diving into something pretty fascinating, I think. You know, trust, right? It's such a fundamental part of being human.
Hmm.
And while sometimes that trust goes a bit sideways, you know what I mean? It can lead to suspicion, maybe even full-blown paranoia.
Yeah, absolutely.
We've all had those moments, right? Like that little thought that maybe someone's talking about you behind your back, or that something just feels a little off.
For sure. For sure.
It's like this weird spectrum, and I think it's something a lot of people have probably thought about. Like, where's that line? When does it go from just being a little bit cautious to something more, more serious?
Right.
So today we're really going to try to unpack all of that.
Mm.
And to help us navigate this super interesting topic, we have the absolute pleasure of speaking with Dr. Daniel Freeman. Now, he's not just an expert on paranoia, he's like a leading voice.
Oh, definitely.
He's a professor of psychology at the University of Oxford, a consultant clinical psychologist at the Oxford Health NHS Foundation Trust, and he's also written a really amazing book called Paranoia, a journey into extreme mistrust and anxiety.
Mhm.
He does some amazing research at Oxford, specifically focusing on how we understand and treat conditions like psychosis.
Yeah. Fascinating stuff.
So for this deep dive, we have a pretty clear goal. We really want to dig into what paranoia actually is, how it's different from those little everyday suspicions that we all have, and how it connects to other aspects of our mental well-being.
Right.
We also want to look at what might cause it and explore some of the amazing new treatments that are out there.
Yeah. Great plan.
So let's get started. Dr. Freeman, when we think about paranoia, a lot of people might just think of extreme suspicion, but you talk about inaccurate fear.
Right.
Why is that difference so important? And can you maybe give us an example where that inaccuracy is really clear?
Yeah. That's a great place to start. I mean, the real heart of paranoia is this inaccurate fear that people are out to harm you.
Right.
And that harm can be lots of different things.
Yeah.
Psychological, like making you feel bad or stressed.
Mm-hmm.
Financial, like they're trying to cheat you or something. Or even physical harm, like actual violence. And it often starts with these things that we call ideas of reference.
Ideas of reference. Okay.
You know that feeling when you think people are talking about you?
Oh, yeah,
Maybe gossiping or spreading rumors?
totally.
So we all have those thoughts sometimes, but they can become a problem when they get tied to this sense that you're really vulnerable, you're especially likely to be harmed.
Right. I see.
A simple example might be like someone with paranoia sees two people laughing and automatically assumes they're laughing at them,
Mm-hmm.
even if there's like no reason to think that.
Right. Right.
So the inaccuracy is that leap to thinking there's a bad intention when there's no evidence.
That makes sense. So those ideas of reference, I think a lot of people can relate to that, that feeling of being self-conscious.
Yeah, for sure.
But how do we tell the difference between those kind of normal suspicions and when it becomes something clinical, like something that needs to be diagnosed? What's the difference?
Yeah, really important question. So when we talk about paranoia that's clinically significant, at the more serious end, it's often what we call a persecutory delusion.
Okay, a persecutory delusion.
This means they have a really strong belief that they're being harmed.
Right.
They might be totally convinced that people are plotting against them or trying to take advantage of them or even threaten them physically.
Mm-hmm.
And the intensity of this belief, it's a really big sign, like they're absolutely certain. We also look at how often these thoughts come up.
Yeah, yeah.
Are they just fleeting thoughts or are they there all the time?
Makes sense.
And how much distress do they cause?
Yeah.
This often shows up as anxiety, even depression. And really crucially, we look at how much these thoughts mess up their daily life.
Right, yeah.
Are they avoiding going out? Are they struggling to work? Are their relationships falling apart?
Mm-hmm.
Those are all big signs.
So it's not just about having a suspicious thought now and then. It sounds like it's really about how strongly they believe it, like how certain they are, how often it comes up, and how much it's messing up their lives.
Exactly. It's important to remember, suspicion is a normal human thing.
Yeah, for sure.
We're always figuring out who to trust.
Yeah.
Right? Because there are real risks out there.
Right.
But paranoia is when that mistrust takes over. It becomes the main way you see the world. You feel unsafe all the time.
I see.
I often say many people have a few paranoid thoughts, but a few people have many.
Oh, that's a good way to put it.
And when it gets to that point, that's when we usually see it with more serious mental health challenges like psychosis or schizophrenia.
Right.
And we have to be really careful to separate paranoia from a real threat.
Mm-hmm.
If someone's in actual danger and they're reacting to that, that's not paranoia. That's just being sensible.
Makes sense.
Paranoia is when the mistrust is way out of proportion to what's actually happening.
Yeah.
It
Yeah.
doesn't match the evidence.
So, how common is paranoia, like a diagnosable level of paranoia? Do we know?
Well, the numbers suggest it's not a huge percentage of people. Maybe around 1 or 2% have paranoia that's serious enough for a diagnosis.
Okay.
But if we look at just mistrust in general,
Yeah.
we did a big survey in the UK with about 10,000 people, a good mix of everyone, and it turned out about 16% said they actually wish they were more trusting.
Wow. That's a lot higher than I would have thought.
It is. It shows you how much this struggle with trust affects people.
Mm-hmm.
It's all about how we figure out who to trust, and sometimes finding the right balance is tough.
Right.
And when that balance keeps tipping towards mistrust, that's when paranoia can set in.
Yeah.
And, that internal risk assessment we do, it's not like a fixed thing.
Right.
It needs to be flexible,
Yeah.
adapting to where you are, who you're with, the time of day, all sorts of things.
Mm-hmm. Probably something we don't think about very consciously.
No, not really, no. We just kind of follow the social norms usually. But for some people, that risk assessment gets really skewed.
16% wanting to be more trusting. That's a pretty big number. It really shows how much this can impact how people feel. So we've talked about what paranoia is and how it shows up, but what about its connection to other mental health issues? We always hear about it with schizophrenia, but you mentioned it can pop up in other conditions too, right?
Yeah, definitely. I mean, the link with psychosis, particularly schizophrenia,
Mm-hmm.
is well known,
Mm-hmm.
and paranoia is common for people with those conditions.
Right.
But it's super important to remember that paranoia can be there in other mental health problems too, like depression, anxiety disorders, even PTSD.
Okay, interesting.
Some of the earliest writings about paranoia actually talked about it with depression and anxiety.
Oh, wow.
And our research has shown that when paranoia is there alongside other mental health issues, those issues often last longer and are harder to treat.
I see.
And that's largely because paranoia can really damage relationships.
Yeah, for sure.
When trust breaks down, it affects everything. So yeah, the extreme forms of paranoia are often linked to the severe mental health conditions,
Yeah.
but we see milder forms all over the spectrum.
Right.
When I first started working in this field back in the 90s, the thinking was that paranoia was pretty much only a symptom of psychosis.
Mm-hmm.
But working with people who had been through trauma and abuse, the overlap with anxiety disorders was just so clear.
Oh,
It
yeah.
really changed my view. It became obvious that paranoia was more understandable psychologically and had much broader connections than we thought.
Yeah.
And as we started looking for it more in the general population,
Mm.
we're finding it's more common than we realized, precisely because it's tied to those judgments about trust that we all make.
Right, that makes sense. So we've got a good handle on what paranoia is and how it shows up, but what about the causes? What do we actually know about what causes paranoia? Is it mostly nature, like something you're born with, or nurture, things you experience, or is it like a mix?
Well, our understanding of the causes has gotten a lot better. Overall, it looks like about half the variation in paranoia we see in people is due to genes, and the other half is from the environment.
Okay.
But looking at it from a more psychological angle, we've found a bunch of factors that can push someone towards mistrust.
Like what?
Well, past negative experiences, like being mistreated, bullied, or betrayed, can understandably make you wary of others.
For sure.
And even worries about your own past actions can play a role. Guilt, fear of getting caught. That can turn into paranoia.
Interesting.
And then there's stuff like excessive worrying.
Hmm.
People who spend a lot of time thinking about potential threats instead of doing things they enjoy can actually fuel mistrust.
Yeah.
Low self-esteem is a big factor too, as well as those negative images of what others might be doing or thinking.
Right.
Sadly, discrimination can also be a powerful trigger for paranoid feelings.
Of course.
And for some people, hearing voices can contribute to feeling threatened. We also need to consider the impact of certain drugs, like cannabis.
Mm-hmm.
We know it can increase the likelihood of having paranoid thoughts.
Right.
The key takeaway here is that it's rarely just one thing. It's usually a combination of factors that all contribute.
Right. Like a perfect storm.
Yeah, exactly. And that combination influences how likely it is someone will develop paranoia and how severe it might be.
That makes sense. So it's this really intricate mix of what's in our genes and what we go through in life. You've been really pioneering in developing new treatments, particularly the Feeling Safe program.
Yeah.
Can you tell us more about how that works? What are the main ideas behind it? And how does it actually help people who are struggling with paranoia and extreme mistrust?
Yeah, so when I started out as a clinical psychologist,
Hmm.
I really wanted to create better psychological treatments for these experiences, which can be incredibly tough.
Mm-hmm.
Back then, the general thinking was that you shouldn't directly address paranoid thoughts.
Okay.
The idea was that they weren't really psychologically understandable in the same way that, say, anxiety was.
Right.
Psychological treatments weren't really recommended, but early work in cognitive behavioral therapy, or CBT, showed that it was safe and could be helpful in reducing paranoia.
Interesting.
And that got me thinking, what are the best techniques for this? So at the core of it, to help someone overcome those feelings of mistrust and unsafety, you have to help them learn through their own experience that they are actually safe right now.
Mm,
And that means gradually getting them back into situations they see as threatening and showing them that they're actually okay.
I see.
But it's not as simple as just throwing them into those situations like we talked about with the causes. There are often other things going on that keep the paranoia going.
Right.
Even if someone's physically in a safe place, if they're filled with worry or feeling really inferior or super vulnerable, they won't learn that they're safe.
Yeah, that makes sense.
So the Feeling Safe program takes a wider approach. It tackles all these interconnected factors.
Okay.
We work with people to help them reduce worry, improve their sleep, and build their self-esteem. The key is to shift from thinking about safety to experiencing it in real life.
Mm-hmm.
And at the same time, we're working on those underlying issues
Mm-hmm.
that could be blocking that learning from happening.
That's a really interesting approach.
Yeah, and another important thing is that we don't directly challenge their beliefs, like telling them they're wrong. Instead, we offer a different perspective, almost like a hypothesis, and encourage them to test it out.
I see.
We're really big on learning by doing, not just talking about it in therapy.
Yeah, yeah.
So we might suggest they try going to a cafe, taking a walk, doing everyday things that let them experience how the world really is right now.
Right.
We totally acknowledge that their past might have been tough and we can't change that, but we focus on helping them discover what their present is like.
Makes sense.
The program usually involves about 6 months of face-to-face therapy,
Okay.
but we've also developed an online version to make it more accessible.
Oh, that's great.
It includes regular contact with a mental health professional.
Hmm.
And the results we've seen have been really encouraging, which is exactly what I was hoping for when I started developing it.
Yeah, that's fantastic. So it's a treatment that really understands paranoia, acknowledging that these beliefs don't come out of nowhere.
Right?
It's about understanding the person's perspective and then giving them a structured way to test out a different view of the world.
Exactly.
So that's the Feeling Safe program. But what about medication? What role does that play in treating paranoia? Is it used alone, or is it often combined with programs like the Feeling Safe program?
For a lot of the people I work with,
Hmm.
especially those who have a diagnosis like schizophrenia and have very severe paranoia, antipsychotic medication is usually the first step.
Mm-hmm.
But the people my team sees are often those who haven't fully responded to those standard treatments.
Okay.
Medication can definitely help a lot of people, reduce how intense the paranoid thoughts are.
Yeah.
But there's strong evidence now that adding psychological therapy, like the Feeling Safe program, can really improve things.
I see.
We often see that our psychological treatment can help some people recover from persecutory delusions, even when medication alone hasn't done enough.
Wow, that's encouraging.
It is, but we also have to be honest and say that not everyone benefits the same way.
Right. Of course.
And that shows we still need more research to understand why. So medications, especially antipsychotics, are super important for managing severe paranoia. But adding specialized therapy can offer that extra layer of support and lead to a more complete and lasting recovery for many.
So it's about using different approaches together to get the best results. Makes sense. You also mentioned using virtual reality in your treatment program. That's really fascinating. Can you tell us more about how you use VR and what makes it such a useful tool for addressing those deeply ingrained feelings of paranoia?
Yeah, I first started looking into VR for this about 25 years ago. Initially, we mainly used it as an assessment tool. One of the hardest things with paranoia is figuring out if it's real or not.
Right.
We don't want to dismiss someone's fears if there's genuine danger.
Of course.
So we used VR to create neutral social situations with computer-generated people, avatars,
Hmm.
who were programmed to act totally neutrally.
Okay.
If someone consistently saw hostility or threat from these neutral avatars, it gave us more confidence that it was paranoia.
Mm-hmm.
But over the last 10 years or so, we've been using VR more directly as a therapy tool to help people learn safety in a controlled way.
Right.
Now, you might think that because they know it's not real, consciously, that they wouldn't learn anything.
Yeah, that's what I would have thought.
But the amazing thing about VR is that your body and mind often react as if it is real, even if you know it's not.
Oh, wow.
So if someone has lots of safe, positive interactions in VR, that learning can actually transfer to real life.
That's incredible.
We've seen really good evidence that VR exposures can reduce paranoia in everyday life. And in a way, the fact that they know it's not real can make it easier to engage with the treatment.
Oh, how so?
It gives them a sense of safety so their brain can process new, safer information without triggering all those threat responses.
That's really interesting.
Yeah, it's become a really promising part of our work.
Mhm.
And another exciting thing about VR is that it could be used to automate some of the treatment, especially in our online program.
Right.
That would make it even more accessible. And VR lets us create very specific social situations that would be impossible or unethical to do in real life,
Mm-hmm.
which can be really helpful for targeting very specific fears.
So if someone was using VR for this treatment, what kind of scenarios might they encounter? What would it be like?
We'd usually start with pretty basic, less threatening things. Maybe getting on a virtual bus with just a couple of other avatars,
Yeah.
going into a virtual shop with a few people, or even just practicing walking out their front door in VR.
Mm.
For people with severe agoraphobia, even that can be a big step.
Yeah, definitely.
Then we gradually make it more complex, add more social interaction.
I see.
So that bus ride might start with one or two other avatars, and then we slowly add more people.
Mm-hmm.
We can also create situations that target specific fears. Like, we might have a scenario where they have to turn their back on the virtual people, something they'd find really scary in real life.
Oh, wow.
We've even made little interactive tasks within these virtual environments.
Really?
Like, in a virtual cafe, a child avatar might start blowing bubbles, and the person has to catch them.
Okay.
This makes them move closer to other virtual people, and then everyone looks at them. So they're the center of attention for a moment, but in a safe space.
That's a clever way to do it.
These simple interactions let them experience everyday social settings, even being the focus of attention. And they learn that they're okay, they can cope. And looking ahead, we're also exploring using VR to target other things that can contribute to paranoia, like low self-confidence. We can create experiences that help build a more positive self-image.
That's amazing. The potential is huge. Now, shifting gears a bit, is there a particular time in someone's life when paranoia is more likely to show up or become more noticeable?
Well, we tend to see a growing awareness of safety and more active decision-making about what's safe, starting in the early teen years.
Okay.
As teenagers become more independent and aware of the world, that increased vigilance is actually normal.
Right.
They're dealing with more complex social interactions, and unfortunately, things like peer conflict, exclusion, and bullying can happen.
Yeah, for sure.
So there's this process of figuring out who to trust and who not to trust.
Mm-hmm.
Sometimes teenagers can become a bit more mistrustful as they learn these social dynamics and set boundaries.
Right.
And it's important not to jump to conclusions and say it's a problem.
Yeah, definitely.
It's part of growing up, learning to navigate the social world, finding that balance between being cautious and being open.
Hmm.
Research suggests that paranoia tends to be highest in adolescence and early adulthood. Then it gradually lessens over time for many people.
Okay.
But then there's sometimes a slight increase again later in life.
Oh, really?
This could be linked to things like dementia or even hearing loss, which can lead to more isolation and mistrust.
So kind of a peak in those formative years and then potentially a rise later on. Interesting. What about substance use? We hear about some drugs triggering paranoia. How does that work?
Well, getting high on some illegal drugs can definitely increase paranoia temporarily.
Mm-hmm.
People who use those drugs a lot often say they experience this. For a smaller number of people, those paranoid feelings can stick around even after the drugs worn off.
Right.
And it seems like the risk of that happening goes up if they use the drugs more often or if they started using them at a younger age. Now, the exact effects can vary depending on the drug and how strong it is, but there's a really clear link with cannabis.
Yeah.
And there's some evidence for a link with alcohol, too.
Interesting.
But it's super important to understand that although drugs can make you more likely to experience paranoia, it's usually not the only cause.
Right. Mm-hmm.
Lots of people use these substances and don't have any lasting paranoia.
Yeah.
It's probably more about the drug use combining with other vulnerabilities,
Mm-hmm.
maybe genes, maybe past experiences. Those things together can increase the chances of having these problems.
So it can be a big factor, especially with frequent use or starting young. but it doesn't automatically mean everyone who uses these substances will develop paranoia. Thinking about the COVID-19 pandemic, such a strange and stressful time for everyone, did that have any noticeable impact on paranoia? Did we see more of it, or did people experience it differently?
That's a really good question, and it's something a lot of researchers are interested in. We don't have tons of long-term data yet, but it's pretty obvious that anxiety levels went up for a lot of people worldwide during the pandemic.
Yeah, absolutely.
One thing that really stood out was the rise of conspiracy theories.
Mm-hmm.
That was probably driven by a mix of factors like more time spent alone, more time online, the disruption to everyday life, and just a general sense of uncertainty.
Right.
Now, it's important to separate conspiracy theories from individual paranoia.
Okay.
With paranoia, the person usually thinks they're the target of something bad. Conspiracy theories are more about a plot against a group or society as a whole,
Mm-hmm.
but there's probably some overlap in those tendencies toward mistrust,
Right.
maybe a greater openness to believing in threats. Looking at individuals with pre-existing psychosis and paranoia, the pandemic seemed to affect them differently.
Oh, how so?
For some, all the social distancing might have actually made things a bit easier, less social pressure. But for others, the uncertainty, the fear of the virus, and being isolated probably made their paranoia and anxieties worse.
Yeah, that makes sense. So it's really a complex picture with the pandemic potentially affecting people in different ways depending on their individual situations and vulnerabilities. What about the connection between paranoia and physical health? Are there any links there?
There's definitely some overlap,
Hmm.
especially for people with severe paranoia, like those with psychosis.
Mm-hmm.
The social withdrawal and isolation that can come with mistrust can be bad for their physical health.
Right.
Plus, long-term physical problems like chronic pain can disrupt sleep and mess with your mood, which can increase anxiety and mistrust.
Mm-hmm.
And we talked earlier about the connection between suspicion and conditions like dementia later in life.
Mm-hmm.
So while paranoia is mainly a mental health thing, it can definitely affect and be affected by physical health.
It's all connected. Dr. Freeman, I'm curious, what got you so interested in this area of mental health in the first place? You mentioned it wasn't always seen as easily treatable, so what was it that drew you to this?
Well, I remember when I was studying psychosis and related conditions at university, the prevailing view was that psychology didn't have much to offer.
Oh, wow.
It wasn't seen as something we could really understand well enough to treat effectively.
Interesting.
Psychological treatments weren't really on the table. But my views started changing when I met my first patient with psychosis. I had to do a home visit because he was way too scared to leave his house.
Oh, wow.
He was terrified that government agencies were going to kidnap and torture him. I even had specific instructions on how to knock so he'd feel safe enough to let me in.
That's intense.
It was. And as we talked, it became clear to me, given his incredibly difficult and traumatic past, why he was so deeply mistrustful. He was basically agoraphobic, totally unable to leave his house. And it struck me that although he had these extreme fears, he never actually had the chance to go outside and see if he might be safe.
Hmm.
I saw so many similarities with anxiety disorders.
Right.
To me, the key to understanding this was to focus on what seemed like a really big anxiety component.
Okay.
He had this constant deep fear of the outside world, and he had really strong beliefs about threats, which is common in anxiety disorders.
Mm.
He was always worrying, always expecting harm, and avoiding things that were probably just making his fears worse.
Yeah, that makes sense.
So that experience drove my early research, where I started measuring worry levels in people with severe paranoia.
And what did you find?
Well, I found that their worry levels were consistently high, which was surprising.
Hmm.
It might seem obvious now, but back then, excessive worry was mostly seen as a problem with anxiety and depression, not psychosis.
Mm-hmm.
So no one was really measuring it in this population. But it makes sense, right? If you're already scared and mistrustful, and then you add constant worry on top of that, it's going to make everything worse.
Right, of course.
It keeps those fears alive and kicking. Another thing that really intrigued me, and we haven't talked much about it today, is the impact of poor sleep.
Yeah, sleep is so important.
It is. And our patients often didn't sleep well, but it was seen as a symptom of their condition, not a possible contributing factor.
Right.
But we know from research that bad sleep can make anxiety worse, mess with your mood, and impair your thinking, including judgment.
Mm-hmm.
So I've also been working on treatments for sleep problems in people with psychosis.
Hmm.
And we've seen that improving sleep can actually reduce paranoia for some people.
That's really promising.
It is. It's not a magic bullet, just like reducing worry isn't. But addressing these underlying issues can really calm things down and create a better foundation for people to reevaluate their experiences and hopefully feel safer.
That's such a powerful story about how that initial encounter shaped your research. For people listening who might be recognizing some of these tendencies in themselves, maybe the anxiety, the worrying, maybe even some early mistrust, are there any things they can do to prevent things from getting worse? Any mental exercises or strategies?
Yeah, and the good thing is these strategies can really help with all sorts of mental well-being challenges.
Okay, great.
First off, getting good sleep is absolutely crucial.
Right.
And then working on managing and reducing worry. Maybe set aside specific times to deal with your worries and then try to focus on other things outside of those times.
Mm.
Or use problem-solving techniques to tackle the root of your worries instead of just dwelling on them.
Yeah, yeah.
Doing things you enjoy and find meaningful is key to stopping those negative thought patterns from taking over.
Absolutely.
If you're struggling with suspicious thoughts, talking to someone you trust can be really helpful.
Right.
A friend, family member, therapist even.
Yeah.
Sometimes just saying those thoughts out loud can take away some of their power.
Yeah, that makes sense.
Writing down your worries can also be a good way to get them out of your head. And finally, try to focus on your strengths.
Mm-hmm.
Do things you're good at,
Mm.
things that make you feel accomplished. That can build self-esteem, which can protect you against feeling vulnerable and mistrustful.
So it's about promoting overall well-being.
Yeah.
Sleep, managing worry, staying active, and connected with others, all really important things. Now, for people who are experiencing more clinical levels of paranoia, do they usually know that their thoughts might not be based in reality? Or can some people still recognize that their thinking might be distorted?
It really varies, to be honest. Some people with severe paranoia have very little insight.
Mm-hmm.
They're completely convinced their fears are true. But lots of others, even those with serious paranoia that's causing them a lot of distress, do have some awareness that things aren't quite right.
Okay.
They might recognize that these thoughts are taking over,
Mhm.
or that they're leading to behaviors like isolating themselves that they know aren't good for them.
Yeah, yeah.
In therapy, especially at the beginning, we often start by acknowledging how tough these thoughts and feelings are and how much they're affecting their life.
Right.
The anxiety, the sleep problems, the impact on relationships.
Mm-hmm.
Then as therapy goes on, we might introduce some small, manageable exercises. Like we might explore the difference between staying home all day and going for a short walk in a familiar, safe area,
Okay.
and just see which feels better in that moment. We're not directly challenging their beliefs,
Mm.
but we're creating opportunities for them to have different experiences.
I see.
And on that walk, they might notice something positive, have a neutral interaction with someone, and those little things can start to build a slightly different picture.
Right, like little cracks in the wall of paranoia.
Yeah, exactly.